Okay, dear all, Dr. Vishal from VISHWA Medical Coaching, and one of the very important clinical finding I'm going to show. Just observe the video right now. What exactly is this condition? Let me play it again. What exactly is this condition? This patient is trying to walk, and he's not able to maintain the coordination, not able to maintain the balance. He's not able to also have a coordination between hands and legs properly. This is a very typical condition which is also common in case of a lot of other disorders also. Can be alcohol toxicity, can be chronic damage. Remember, this is a typical feature of an cerebellar ataxia. Ataxia stands for loss of coordination as well as loss of equilibrium. This can also be produced because of the vestibular problems, because vestibular is also involved in maintenance of balance as well as equilibrium. But this is one of the very common thing. It may be because of the chronic misuse of the drugs. It can also be the thrombosis in the cerebellum. It can be uh, the physical injury to the cerebellum. It can be degenerative disorders to cerebellum. It can also be progressive if it is a degenerative disorder. Of course, treatment what we require is giving an antioxidants, giving a vasodilators may help, but most of the time we require the drugs to maintain the good blood supply to the cerebellum. Thank you very much.